Hello and welcome to another episode of Knowledge Cafe, a podcast for the seniors, bringing stories of inspiring seniors. Today we are our esteemed guest is Dr. Sanjeev Kumar. If I read all about him, I think the whole episode will be over. He's so qualified, so experienced, so well, traveled. In short, he is a public health physician with 47 years of experience, MBBS starting with MBBS and MD from AIMS, and MBA from UK, and many other qualifications, on health financing and other areas. He has been in many prestigious positions, and he was telling me that he was started with NCC also. He wanted to be in the army also for a short stint. And then he joined UNICEF, where he has been, in many countries like Somalia, Iraq, Kenya, Uganda, Bangladesh, working on immunization in maternal health and so many other health systems. In India, he has also been a director and dean of IHMR, director with National Health Resource Center, and I assume a chief architect of National Health Policy in 2017, and also the man behind National Health Research Policy 2021. He's presently, I think, focusing on leadership, capacity building and leadership in for health professionals and top institutions, VCs and many other institutions, and I believe there is a expertise that's called three domain expert management system or leadership process, which we will know more about. And thank you for joining us today, Dr. Sanjeev Kumar. मुझे सबसे पहले तो ये पूछना है कि डॉक्टर कहना चाहिए या प्रोफेसर कहना चाहिए? आप प्रोफेसर भी रह चुके हैं.
When the doctor has stuck to my name much longer than professor.
Okay. So हमेशा से डॉक्टर बनना चाहते थे. You were wanting to be a doctor right from beginning. It's a question you asked. Our generation, many decisions were taken by parents.
Thank you, Maltini, and thank you, Pranita, for organizing this. When I look back on my childhood, my memories take me to when I was 4 years old. And even that time, I thought of becoming a doctor. मेरे पेरेंट्स ने दिमाग में डाला कैसे, पर हमेशा तो मेरे सबसे छोटे भाई वो 3 years younger to me, वो रो रहा था. तो मुझे लगा कुछ बीमार होगा, तो घर में दवाई पड़ी थी पोटेशियम परमैंगनेट, लाल दवाई. तो हमने कहा वो भी दवाई है, तो मैं कटोरी में घोल के उसको देने लगा. फॉर्चुनेटली माय पेरेंट्स वॉक्ड इन. और उसके बाद स्कूल में भी था. रिमेंबर आई वाज इन क्लास 8, तो हमारे पड़ोस में देशी बहन भी बोलता था लाइक माय सिस्टर. तो शी हैड एन एक्सेस ऑन हर थाई. तो वो हॉस्पिटल जा रही थी ट्रेन करने. मैंने कहा मैं डॉक्टर बनूंगा, मैं चलता हूँ साथ देखूंगा. तो हॉस्पिटल में गए, तो डॉक्टर को मैंने बोला मैं देखूंगा, डॉक्टर बनो. ही वाज आल्सो वेरी हैप्पी. अच्छा देखो. By the time he gave incision and blood and pus started coming out, I was fainting. अब मैं बोलूं कैसे कि मुझे चक्कर आ रहे हैं. So I started walking towards the gate. तो रास्ते में कोलैप्स हो गया. तो उनको छोड़ के डॉक्टर ने it was in my mind, but that incident gave me an idea. Surgeon तो नहीं बनूंगा.
Okay.
So it was right from childhood I thought.
Okay. And then, AIMS is a very prestigious institution to do MBBS and MD. How was that experience? You had many mentors from there?
Yes. No, AIMS, my grandparents used to live in Green Park, and AIMS was next door. तो उन दिनों हिसार होम टाउन का वहाँ कोई लिफ्ट नहीं थी. एम में लिफ्ट थी. तो हम चारों भाई रोज शाम को विजिटिंग आवर्स में लिफ्ट में घुस जाते, तो ऊपर नीचे जाते रहते. तो दैट वाज माय फर्स्ट एक्सपोजर टू एम. पर कभी सोचा नहीं था यहाँ पढ़ने आएंगे. बट व्हेन आई वाज इन सेकंड प्री मेडिकल, तब एम्स के बारे में सोचने लगे. luck would have it, I got admission. AIMS was a different exposure. When you were in up to class 12, very strict classes, attendance, discipline. AIMS were relatively more relaxed. Then teachers were more like parents. Okay. In AIMS, and we used to have something called Institute Family. Okay. So one of our teachers used to be our parent, formally designated.
Guardian kind of.
Guardian, right? उनके घर जाते थे. They used to look after घर का खाना खाने का. it was more very relaxed. Academics, yes, academics. Our teacher was one of the best in the
Best.
in their area.
Yes.
But at the same time, इतना regimentation नहीं था. We were free to learn, ask questions. We could ask head of the department what you are saying. I don't agree with you. I'm not convinced. And they would explain it to us. इतना regimentation जितना बाकी medical colleges में होता है, एम्स में नहीं था.
That's very nice to know. I hope it still continues.
Yes, the tendency to ask questions is on. But in AIMS, I think it may have diluted a bit, but it's still there.
Still maintains.
Yeah.
You know, AIMS is very respected even
Yeah.
today. I think the professors and the doctors there, the caliber and the
Yeah.
equipment and the commitment, all
That is.
I think all is very very appreciable.
नए एम में कितना ट्रांसप्लांट हुआ वो नहीं कह सकते, नाम रखने से तो नहीं बनते. Culture has to be.
Yes,
Yeah.
yes, that's true. It takes a long time and commitment of leadership to develop an institution.
Yeah.
It's not developed overnight. So anyone else in the family, 4 brothers you said they also became doctors? You're the only chosen one?
मैं तो कोई नहीं, फिर हमारे परिवार में I married a doctor and my elder daughter is a doctor,
Okay.
but not.
Oh, okay. You were telling me that you had also, after you actually wanted to be, in the army and you were very impressed with that and you were the national level shooter or something.
Yes.
For in the NCC you joined for 5 years.
Yeah, I was in NCC.
Doctor NCC कैसे join किया?
Yeah, no, in my school days, I was very keen on army.
Okay.
So I joined the NCC when I was still not eligible. So I went to the teacher who was in charge of NCC.
Okay.
And he told me, no, we will not take you. You're too young. So I said, no, I want to join you. Good in studies, usually teachers have soft corner.
Absolutely.
मैंने मेरे को तो ज्वाइन करना है, तो यूनिफॉर्म नहीं होगी, मैंने कहा नहीं, मैं यूनिफॉर्म अपनी माँ को बोलूंगा, वो मेरे साइज का बना देंगी. जूते नहीं मिलेंगे, बाटा में जूते मिलते थे, मैंने कहा मिल जाएंगे मेरी साइज के. तो he had no reason to deny, so I joined NCC very young, and I became sergeant, and then I was in the shooting team, in the battalion. One of the top shooters. So गोली चलाता था सीधी, what they call it bullseye. उसमें लगती थी. So that's how. But wanted also to become a doctor. After becoming a doctor, landed in the army. My first job was in the army.
Okay. Okay. So from the army, then you joined UNICEF. Was it directly you joined UNICEF or you had some clinical practice before that?
Yeah, immediately after MBBS, the last day of internship, I traveled to Lucknow, and next day I joined the army. But it was too much of regimentation, and as I told you, in AIM, we were trained to ask questions, so it was uncomfortable when I will ask a brigadier and tell him what I think is right and what you are saying is wrong, and that's how professional life should be. So it became very uncomfortable. So for 2 years I was happy, then I started feeling suffocated. So I left, came back to do my MD again in Pune. Then I also taught for 2 years in University College of Medical Sciences.
Okay.
And then I went for an assignment to UNICEF, short assignment.
So how did UNICEF happen? Like, at that time, UN was not, I think was not a choice for doctors particularly, I assume, right?
Yeah. No, you're right. Those days, I'm taking you back in time to 1988, when the world, WHO and UNICEF had taken on universal immunization as the goal for the whole world. And I used to go and take lectures for training of teachers in the water control program. Those people trained करते थे बच्चों को screen करने के लिए. And then this consultancy for UNICEF, Jaipur. So I was there for about 3 months. And when I was coming, they said, would you like to join UNICEF? I said, yes, I like your work, benefiting, immunizing so many children, saving so many lives. So, and those days salaries were more or less the same as I was getting as a lecturer. But the work was very exciting. So that's how finally I applied.
Work in culture of UN organizations. I think culture of UN organizations is also something unique. I
Yeah.
think they have a culture of their own of serving, of of societies, communities. I think that brings me to the question of like this as a public health physician, it's very different than a normal physician, right? So public health planning, planning goes, and then working in Somalia to Central Asia later on. It's such a vast range of roles and other countries that you have been in. So some prominent, recollection of some episodes or some learnings that you had from these experiences.
Yeah, no, there's so many memories, but to focus on a few. Starting in Rajasthan, and when somebody asked me to describe what did I do I said I worked in deserts of Rajasthan and the nomads in Kenya who were still living in the wilderness. To give me good and the battlefields of Iraq, Somalia, and so on. To give you a few instances of my work, starting with Rajasthan, when I landed there, immunization coverage in 1988 was ranging from 15 to 20%. And it was a tough task to bring it to 80%, that was the target. So you couldn't have done it just through the health system. So we mobilized sarpanches. I remember there was a kind of a conclave of all sarpanches of Rajasthan. I think about 20,000 sarpanches have got together. So for that, we wanted to give them a message. So somebody told me we need a pamphlet on immunization. So 20 questions on immunization. I was fresh from my work in the primary health center. So I wrote down in 2 hours 20. I wrote 22 questions. Finally, they said 20 looks better. So narrowed down to plan. That was distributed. And on the cover of that pamphlet was a picture of his sarpanch with a turban.
Oh,
Mustaches, typical Rajasthani sarpanch. And at the bottom, I will make sure that every child in my village is vaccinated. Mobilizing school children, Nehru Yuva Kendras. There were about 900 of them, predominantly rural areas. To mobilize them, and very satisfying that by December 1990, we got to 80%.
Wow.
Except in measles, it was 79.6%. So little bit of that.
Technically 80%.
But in other vaccines, that was one instance. And then second instance, when I went to Iraq was of Saddam Hussein's day. And UN had put sanctions and UN was running program.
Oh.
So we were more like, not labeled as persona non grata, but we were more like that. Nobody wanted us. But
Yes.
they had no choice because we were selling the oil and putting the money in the program. So in one of the first meetings, and trained in ANU, you speak up. So I made a lot of noise in a meeting when people had come from UN headquarters to uh, train us in planning for emergency. So I said, the worst emergency is what you have done to Iraq. A lot of children are dying because of the UN sanctions. And the intelligence would give feedback to the president's palace.
Okay.
So, and earlier when I wanted a meeting, they would say, hold on, we will come back to you. A representative from President's Palace will come to the meeting, take all the notes from the meeting and give feedback. Next day, I get a phone call from the Director General of Health Services. Dr. Sandeep, walk into the ministry anytime you feel like. And probably the world went around that there is a man, an Indian, but feels so strongly about Iraqi children and so strongly about the sanctions because of these children. In fact, infant child mortality rate had gone up manifold because of the sanction. So that was second instance. And, comment I made, which I felt very strongly, and that made me get easy access to the authorities. And during my rest of the stay, it was very cordial relation. They will ask me what to be done, invite all the officials from the field, ask me to give them training and improve life of women and children. So that was the second instance. So if you communicate, you speak for what you are doing, things fall in place. things fall in place. But if you are diplomatic, polite at times, it may go against you. But if you speak from your heart, your work gets easier.
That's very well said. Actually, that's very well said. In fact, that's what I think most of the generation of our generation, the seniors, generation feels. The maybe the younger generation don't feel that way as yet, but as they grow, I think they also come to their basic principles do not change. So now, working in different, countries and Central Asia and all of these African and other countries, and you've also studied in UK. What do you think, that would be one thing which we could give to the rest of the world, the rest of the world could copy from us, or they have copied from us, and what it is that we could have copied from them better?
And it takes me back to one of these days, last couple of years, I've started going deeper into Sanskrit scripture.
Okay.
And when I was in class 12, I read this in Sanskrit class. Ayam nija paroveti ganana lagu chetsam udar charita nam su vasudhaiv kutumbakam. Everybody knows Vasudhaiv, but where does it come from?
Oh, yes.
And having gone around the world, met people with different languages, different skin color, different culture, this realization became much stronger that we are all one family. The differences are only skin deep and tongue deep because color is different and languages are different. So, because of that feeling that we are one family, and that's part of spiritualism. So, you go in a place, all strangers, nobody speaks your language, but still you feel comfortable. So, that is one ancient Indian wisdom which we can share with the rest of the world. And now in G20,
Yes.
the slogan was
Of course,
Vasudhaiv
Yes.
Kutumbakam. What we can learn from other countries, and some other countries like Bangladesh, which are not as well off as we are, the community level work, community ownership. I remember when I visited Bangladesh, I went there on 3 occasions, and when I will visit a sub-center, most peripheral health facility in Bangladesh, meeting would be held. Who will be chairing the meeting? The local village head. The land to the building, maintenance of the building is done by that person, and they really feel very strongly about the work. And they will be running the show, asking health worker what more needs to be done, how they can contribute. And maybe from some African countries and also from US, UK, and Gulf countries, we have a cadre of full-fledged doctors, MBBS. But we don't have somebody between a doctor and a unqualified practitioner. All these countries, for example, in the US, you have clinical assistant. And similarly in UK, Canada, they have somebody at that level. They may call it physician assistant or clinical officer. In Kenya, for example, they have a clinical officer trained for 2 years after class 12. And he would be running an OPD full of patients. 95% of patients don't really need a medical doctor. So they will treat cough, cold, diarrhea, common ailment, minor injuries, and refer those who are. We have not gone for that. In between, government wanted to.
Yes, there was a talk about training those, bridge course or something.
Clinical health officers.
Yes.
They are doing it, but they are confined only to health and family welfare center, not outside. In US, for example, when you have an emergency, my younger daughter fell down once and we went to the emergency. The person who saw her took history, got an X-ray done. She had fallen down on the back, and we were wondering if the tip of the spine had got injured. So they got an X-ray done. Then the orthopedic surgeon came for 5 minutes, looked at everything, prescribed medicine. There is no bone injury. Take medicine, and within 5 minutes, her job was done. In India, every patient needs to be seen by a doctor.
Yes, we don't feel satisfied. Somehow. It's the patients also. I think if the government was to adopt, I think a lot of work will have to be done with the patient side also. That I'm not being seen by a doctor.
Yes. And the other side, Indian Medical Association is always up in arms. No, we don't want that. There were a lot of when they had clinical health officers. Somewhere, the bridge course you were saying, Ayurvedic physician and nurses can be trained. They're being trained now. 6 months course and they can see most of the common.
Yeah. I think in that rising, the lot of, the regular stuff could be done by them, making the doctors burden less and the quality focus by the doctor will be there.
So there is shortage of doctors, shortage of specialists. Why don't we have somebody who can be, recognized officially as an assistant to the doctor and do most of the clinical?
So you were telling me about, while drafting the national health policy. So besides the, there are considerations of the, whole system approach is there. And of course, then there are economic considerations, then there are population level considerations, and there are political considerations, right? So how do you manage all of this and come out with a document, which serves the purpose beautifully well, Raghav?
No, we just completed a course with 8 sessions on health policy. But to tell you in brief, there are determinants of a health policy. Before
Yes.
you start writing the policy, you look at the constitution. Where does health come in the constitution?
Okay.
Health as the universal right or human right is not there in our constitution.
Yes.
But we have right to life.
Yes.
And Supreme Court is the one which interprets the
Which has interpreted,
constitution.
yes.
And they have interpreted that right to life includes
Right to
healthcare
Yes.
and nutrition care. So you look at that, then we are governed by a political system. Constitution is there, then you have political parties. So you look at the dominant political party, if they have a alliance before the election, they have a common minimum program. In this case, it was not there. So in 2014, I am taking you back in time. So you had the BJP which had come to power. So you look at the party manifesto. You also look at the party. Every party has a constitution, like we have a national constitution.
Okay.
So you look at that. Then you look at the opposition, because when it goes to the parliament, it will be opposition making noise. So you look at their manifesto and their constitution. So what you draw has to be in line with. Then coming to economics, burden of disease, what people need. You look at various aspects, and economy had just started booming in India. A lot more money available for health compared to what we had.
Yes.
So you look at all these components, but who makes the policy? Politician. So you have to make sure that the party manifesto is considered and reflected in the policy. Otherwise, it will get stuck there. It's a political document. We feel it is a political document for health. It is a political document.
But I mean, I had a friend who also is from public policy space, and he used to tell me when I would say, why don't politicians, look at it? He says that, in fact, their perspective is quite right, because they have public orientation. The bureaucracy or the technocrats do not have that orientation towards public as much as the politician brings to the table.
Yeah.
So in a way, that's it. That's the right perspective also in public policy as such. So of course, I mean, we know sometimes things maybe,
The
1 year.
perspective changes, Bharti. A politician looks at next election. So you're very right. They will have to declare something as early as possible after coming to power. And bureaucrats looks at, normally their tenure is 2 to 3 years. They look at what they can do in 2 to 3 years so that they get the next promotion. It is people in the field like public health professionals who look at longer term.
Yes.
But you can look at longer term, but you have to keep in mind who are the decision maker, who will stop your policy at their perspective.
You have to take them along. You have to inbuild their interest as well. That's all right. I think incentives drive everything. Incentives drive human behavior.
I agree. No, there's nothing wrong with it, but
Yes.
you as a professional have to keep that in mind. Otherwise, your policy will get stuck.
Yes. I was very curious to know that now you have moved to, teaching leadership, from the clinical side, you have moved towards, building capacity and the leadership, in the health and research and on the academic side. How do you see the two domains, kind of combining in your head, first of all?
No, first let me tell you how I realized this aspect.
Sure.
At the age of 53, when my daughter was in class 12, I thought nobody taught me formally help management and leadership. Those that they used to talk about strategic management. So this word was, I only knew the word, what does it mean? Not very clear. And most of the people who were using this word, they didn't know. So I looked around for an MBA course, and I found one course where I didn't have to leave my job. I could leave on the job and go and appear in a few face-to-face courses and submit all my assignments on that. It opened my eyes. Though we doctors use clinical management, which is precisely the way management is done, but we never apply it to our work.
Okay.
Other than clinical work. And leadership is never taught to us. And we are very hierarchy conscious. Senior one says you don't ask a question, and then if you ask question, you get into trouble. And then I started applying those skills. The first place where I applied what I learned, for example, emotional competence in my daughter. She was
Okay.
a teenager, and all of us know, you are very fresh with your teenage method. And we reflect, we have our children who are teenagers. So that's a very difficult period of time.
Mhm.
And you often get into conflict with your children as parents. So I learned emotional competencies, and that changed my perspective. I will talk to my daughter, but look at things from her point of view.
Okay.
Here is a girl who was brought up in India, had an elder sibling, has moved to a new country. Culture is different. She has no sibling, no friend, and how much stress she must be undergoing. And then for about 4 months, Nita had to come to be with my elder daughter who was in MBBS. Her first exam, and we had promised one of us with her. So when she came back after 4 months, I see a different relationship between you. You are not fighting anymore. You hardly have any differences. So I started understanding her perspective. And in one of the sessions, I was taking people, we don't ask you question, we ask her question. She was with me.
Okay.
How that learning of emotional competencies change the relation between me and my.
So that was the journey into management.
And then, at workplace, certainly you need these skills. But what I learned in management in my MBA, most of the skills are important for my personal life and also for social life.
Okay.
If I apply it in my personal life and social life, I will be well placed to apply it in my professional life. People feel it is only for profession. At
Yes.
home, I am a different person. In social circle, I am a different professional. It is the same thing, the same set of skills
Yes.
which you use in your personal life,
Yeah.
social and professional life. Change my perspective completely. And leadership, and I was, trained in a good medical institution. You become a bit arrogant. What I am saying is right. You may be right.
Yeah.
But the way you deal with people, the way you convince others so that they work with you.
Persuasion.
Yes. So you have to look at it from their point of view and take them. Leader is the one who gets work done from others. He doesn't do all the work required. So that you can do only when you look at the perspective of others. So I started doing training when I was still in the UN, team building, training, some of the skills I had learned. And when I came here, then we started designing the courses and the three domain model.
Yes. I'm very curious to know. Can you just explain? I mean, I did Google and I did, know a little bit about it, but I think it will be good to know from your side. How do you view it and how do you apply it? How do people apply it in real life?
As I told you during my MBA, this course on applied leadership was very interesting. So I read a lot. I read 6 books and more than 100 articles, top journal, Harvard Business Review, and so on. But I was so confused. Every theory was different and every concept was different. What is in it for me, I can use to improve my leadership skills.
Okay.
Totally lost. Each concept, each theory was very different. So I took a break for 1 week and my wife was saying, my daughter was saying she was with us in Geneva. And she said, Baba, kya ho gaya? Aap padh nahi rahe. I'm totally confused, so I have taken a break. So after about 1 week of reflection, I developed this model. The 3 components to leadership. One is you. If you cannot lead yourself, you cannot lead anyone. Forget about it. Then you have to lead your team and department or whatever you call it. And then you have to keep an eye on what is changing in the external world. Because most of the changes in health or in any field are not taking place because of the changes in health. You are having technology which comes from outside and is applied to health.
Interplay of other sciences.
Interplay of other factors. climate change, nobody in health is doing anything to it, but it is coming from outside and changing everything.
Absolutely.
So you have to keep an eye on what is changing in the outside world, which is impacting health. So this is in brief the three domains: you, your team, and external.
So it's kind of expanding your circle of influence. First you influence yourself, then your immediate, peers and family,
Yeah.
then the environment.
And all three happen simultaneously. For the model, we have put them in three
Yeah.
categories at the same.
They happen in
For example, emotional competencies. I need to read my own emotions. I need to know when I'm getting angry. I need to know what are the triggers which
Yes,
cause that.
buttons which get pressed.
So I work on that. Emotional competence is not emotional blunting. Emotional competence is managing your emotions. So first you understand your own emotions, your own behavior, then you start reading emotions of others.
Okay.
And how you interpret, you look at body language, and the moment you anticipate something, you start. Don't leave it to come to a stage when it all boils up. So you look at it early and then manage.
Have the steam off early.
Yes, manage others and make them cool down and bring them to. What I do when I teach, you have the primitive brain and then you have advanced human brain, cerebral cortex. I call it decapitation takes place as primitive brain because your emotions are so overwhelming that the logical brain is cut off. So you behave in a manner, people say, oh, what has happened to Sanjeev Kumar? He never behaved, then what is happening? Because your logical brain is cut off because of intense emotional activity of the primitive brain.
Yes, yes. That's very well said. Couple of things from the points that you made about climate change. So we are all experiencing it. So what are the new things that are coming in the medical domain which are related to climate change? Are the doctors acknowledging that this is happening due to some climate change event? I believe that some doctor somewhere had said pollution is the most visible example in Delhi, sitting in Delhi. But then extreme heat, extreme weathers, and so how is the medical profession responding to climate change without having a course in the curriculum as yet? Do they have a course in the curriculum?
No, they do teach.
They do teach. I'm very happy to hear that. Yes.
And a lot of courses. At least 5, 6 sessions I have facilitated, invited to
Okay.
talk about it. Climate change is happening because of human behavior.
Yes.
And let me go back in time. Earth is warming. It was warming even before humans came. It was all,
Yes.
what do you call it? Ice cap,
Yes.
all ice, and then gradually became warmer. Then the light started coming, and then the humans came. So it's a normal process. What we have done is because of human activity, we have accelerated the warming. The vehicles we use, air conditioners we use. Earlier we used to have closed fluorocarbon, CFC we call it, and which will block, and ozone will have, ozone layer will have holes, we call it ozone hole, and then the rays which are normally blocked by ozone layer.
Yes.
Will reach as a factor of health. And then cutting of forests. We are denuding then no, you probably have seen it. When we used to go out of Delhi, we used to get fields and the jungle and trees, etc. Now you can go for 50, 100 kilometers out.
All you see is high rise.
Everything is
all highways surrounded by high rise.
So that is one. The forests are disappearing. The agricultural land is disappearing, and then the high-rise building. These are they accumulate temperature. And when we were kids, maybe even your childhood, you will remember, we used to sleep outside. It was
Yes.
very comfortable. Days were warm, but nights used to be cold. So
Yes, I don't remember nights being very hot. I don't remember in my time. Sleeping outdoors was the norm. No, how is the medical profession responding to this climate change?
There are two things. One is our individual resilience.
Yes.
Each one of us needs to be prepared. When you have heat, you take care of yourself. Wear a hat, take a lot of water, and your activities should be adjusted so that during the odd part of the day,
Extreme.
you don't do outdoor activities.
Yes.
You stay indoors. So one is your personal resilience. Then certain food items, don't go empty stomach.
Mm.
Go out after drinking water. So you will be increasing your own resilience to exposure to heat. Second is the health system resilience.
Yes.
Because of heat, now the natural calamities have increased, the cyclones, etc., coming
Floods.
more often in India
Flash
and also
floods.
in US. They are facing it more than what we face in India.
Yes.
So these cyclones they impact our lives. So the health system has to be prepared for that. The surge capacity for some of the diseases getting like mosquito-borne diseases, they are more likely to happen when the temperature rises. The pattern of diseases has changed. The pattern of climate, I would say weather rather.
Weather,
Climate
yeah.
is overall change, but the weather, rains come late or they come early or there excessive rain, the heat, every year you break the records of the heats and so on. So health system has to be prepared. They need to have capacity to deal with this increase in first is pick up those early signs. When there is a slight increase in number of cases, they need to be alerted and then take care of that. So there are two fronts of health
Of dealing with it.
should be managing climate change.
So I was reading that you are also been very prolific writer, research papers, more than 150 publications to your credit.
I want
So
to
what kind of range of topics or range of subjects that you have, which kind of which are your first passion, let's say, as far as the writing is concerned?
No, initially when I started writing, these were related to research. You do some research, study on humans, and then publish. But when I got into training in leadership, most of my work is on the leadership skills.
Okay.
Going to depth of what, for example, we talked about emotional competence.
Yes.
At least on few occasions. How one should acquire those skills. So these are more of applied, and then there are advocacy articles. For example, we were advocating for public health cadre. There should be public health qualified people at every level in
Yes.
in the health system. Government has launched that program a couple of years back. So started writing advocacy paper in 2016. So wrote two papers, and those papers were used as background material when a group was created to now these days advocacy for leadership skills to be included in undergraduate medical course, undergraduate or postgraduate. The faculty has to teach them that. So what should be the skills for faculty? So then this is
So skills for the faculty, you said that. Do you think the students' profile or the students', persona is also undergone change and the way they now look at education, the way they are being trained? Is that also undergone any change when you interact with, you are still attached with PGI and IIM Jodhpur
and I was also director of that.
Yes. So how do you see the change in the students?
The students today are very different. They're very smart, I would say, compared to our generation. In our generation, whatever the teacher said is like semi-God, we will blindly follow that. These days, students are much better informed. They have access to internet.
Yes, in the class they are using.
Yes, yes. And that time when I'm teaching, I ask them to open the internet and find an answer to a particular question. And many times I have faced that situation when the students ask me a question, I didn't have an answer.
Okay.
And I am honest. I always tell them, no, I don't know this. I will have to find out. But can any one of you do that? Half of the time, there is another student in the class who comes up with an explanation and has the right answer. I go back in the night, read about it, and then come back and compliment the student who gave the right answer. Or if there is a change, then I go back to the class.
Yeah, I think now it's even gone ahead. I was yesterday only, there was I became aware, you become aware through social media so much. So this AI doctor in WhatsApp.
Yeah.
So AI doctor in WhatsApp, so you can pose any query to AI doctor and it promptly gives the answer. So now I don't even need to Google. I just need to save the number of AI doctor. I saved.
Yeah.
And as a first question, I just, asked, what are the sources of good proteins in plant-based diet?
Yeah.
And it gave all the answers: tofu, lentils, chickpeas, all the answers, nuts, and what you could include, and they're fantastic source. You need to know. I mean, it was less than half a minute.
Yeah.
Less than half
Yeah,
a minute.
yeah.
I mean, I wonder, and I'm sure the AI is being applied a lot more in
Yeah.
healthcare. I mean, when I was early days of PMJ, we were also looking at there are a lot of radiology AI which can see the human eye compared to the machine
Yeah.
reading the X-rays or reading the reports
Yeah.
and predicting and making is amazing. The application of AI. One wonders where we will be.
So I remember at time when I was director of this academic institution, many times students would walk into my office and complain. What was the most common complaint? Such and such teacher had presented what is there on the book. Copy paste it from there. They're very smart. And then I will talk to the faculty, explain it to them that they need to do some more homework than just Googling it. And
Yes, I was reading recently a cartoon where a teacher and a student are there. Student has said ChatGPT could create an answer for this.
Yeah.
And the teacher, while checking the notebook, is asking ChatGPT, is this answer created by ChatGPT? So,
Yeah.
so both are using the ChatGPT for different purpose. Okay. So now coming to the interesting aspect of aging, healthy aging. Now we are all, India is becoming silver, India is becoming, gray. We are 10% of population, and this is also UN decade of healthy aging.
Yeah.
So what do you think, that this UN decade of healthy aging has kind of brought the, kind of focus to, or has helped to look at things from which perspective, and how ready in India we are, equipping our seniors with healthy aging effectiveness.
Yeah. A little bit on how these dates and years and decades are decided.
Yeah.
When at global level, there's nobody superhuman who comes to the UN agents. It's all the member countries. So when all the member countries come together and they decide this is the priority area, we need to do more work on it, and then they declare like we have World Health Day.
Yeah.
Childhood development was 7th of April. We did that. So they identify what is the priority area. Aging has emerged as a major problem across the world, and in India the population is aging more rapidly because when I was born, our average lifespan was 32 years. So
Yes.
born in 53, 1985, you would have read my obituary, doctors trained in hands and so on. But now I'm 72, get close to 72. And average lifespan has gone from 32 to 70 plus.
Yes.
And women are living 3 years more than men in India today. They
Yes.
have crossed earlier they used to.
Yeah, there is a gender bias in longevity.
Yes. And then there's another aspect to it because normally men marry women. That's our
Yeah.
culture who are younger.
Yes.
So it has implications, 3 years longer, and then if it is 3 or 4 years younger, so she
Yeah.
will live 6 years as a widow
At
alone
least, yes.
by herself. So
Yes.
there are many other social aspects because of
Feminization
aging
of aging, yeah.
which has come up. And when my father retired, he retired at the age of 58. So when he retired, almost written off by the family and in the social circle. But today, because most of us are very active, even after retirement, I don't call it, I call it second career. When you
Yes.
retire, second career is very close to my heart. You do what you always wanted to.
Absolutely.
And you don't
Not
have-
many freedom, not much freedom.
Yeah, I don't have restriction of the job description.
Yes.
Half of the job and the description you don't like.
And not even worried about raising children.
Yes, you have done your responsibility. Your children
Yeah.
are settled. This is the time we all need to realize that we have a lot of wisdom, we have a lot of experience, and we can contribute a lot more to the society than we have been doing in the past. Not worried, most of them not worried about finances, pension and saving. Take care of that. So aging is a part of life course. We are born, we are children, then we become
Yeah.
adolescent, then we become youth, then middle age, and so on. So this is each phase of life has different characteristics. So some of our physiological functions slow down. That's part of life course activity. So keeping in mind that it is just a phase of life, but what we can do with the restrictions with aging which has come so that we can continue to be productive to ourselves, to take care of ourselves, our health, and our the time well spent, our family, and the society. So that's how I look at aging. Government has programs. We have national plan. How much is being implemented? There is always a question to that. But in 2017 policy, they have rolled out what is called comprehensive primary health care. So there used to be essentially family planning, maternal child health immunization at the
Yes.
peripheral level in the health sector. Now they have 12 components, including geriatric care,
Yes.
including non-communicable diseases. Many of us, at this age, have high blood pressure, diabetes, probability is more. So many of those things are now included in the package of services provided in the
Government.
health care. Health and
Yes.
Wellness Center, now they call it Arogya Mandir, which will
Yes.
name.
Yeah.
So they have
It's emotionally resonating,
Yeah.
like, so what would be your, advice to or suggestion to, people, who are in the senior age category, senior citizen category to stay active physically, active or mentally? What would be your suggestion to them or advice to them? Because you are a living example of that yourself, right? So what's your advice to them?
Yeah, I will say there are two, three components to it. One is accept. Aging is happening every day. Some of our functions are not as well as they used to be in our youth. So accept that, and with accepting it, what we can do to get the best out of our body. To
So
contribute.
any particular exercise or regime that you follow yourself?
Yeah, my wife is more particular than, and so she forces me every day morning. So we do yoga. So it takes about an hour in the morning.
आप खुद से करते हैं कोई
खुद
teacher?
करते हैं वीडियो लगा के बेसिक एक्सरसाइज तो वो
ठीक।
करते रहते हैं. Balancing exercise is what we do for about 10 minutes.
Okay.
Because with age, you tend to have disturbance in balance. So
Okay.
you're more likely to fall down. And then there could be head injury or breaking bones and other
Okay.
things which may happen with. So balancing exercise is very important, and those who are interested can
Strength
balance,
yeah.
and then muscle strength. So minimum body muscle strength needs to be.
आप घर पे करते हैं दोनों?
घर पे
और सुबह
वीडियो लगा लेते हैं.
Okay.
और बीच में तो कोविड आ गया था ना, तो आदत पड़ गई घर में करने की. तो 30 minutes you have various trainers who have their videos.
Yes, of
30
course.
minutes walking, 20 minutes walking, brisk walking, and you can find what suits you.
Absolutely.
But initially, my suggestion is when you take physical activity, you should have somebody to guide you.
Yes.
People do yoga.
Take it as per your capacity,
Yeah.
right? Do it as per your
No,
capacity. Don't get over enthusiastic day one,
Yeah.
and then there is no day two. Then there is no day two because
So this is one area. Third aspect I feel which is important for you to keep busy. If you are professional activities, you enjoy doing it, continue doing that. And try to go out of the house. You don't get people to your house. You offer to go outside the house and contribute. If you're on a governing board and an institution wants you to come and share your experiences, you can do that. If you're fond of writing, that takes a lot of time. You have to review literature. You can continue writing. You can maybe write something for your children if they want to read. And I dug out my letters from my youth, which I wrote to my parents this time.
oh really?
So I'm going through them, and what I wrote. So when I share it with my children, they feel very happy.
So what were those? Give us some idea about what were you, concerned about that day, those days, or you were informing them or sharing with them?
Yeah. My father was very well read. His interest was history and geography. He has never stepped outside India, but wherever I went on international travel, he would tell me about the place. So he started in MBBS. My 18th birthday was in AIMS.
Okay.
So relatively young. So my mother had asked me to write a letter every day to him.
Okay.
So every day I would write a letter in the evening.
Every day?
Every day. And in the morning, going to the class, I will post it in the letter box. So that would be routine. What happened if there was some, minor illness, that also I will describe. What happened in the class, if there's something important. And my father read my books before I read them.
Okay.
Voracious reader. So he would understand when I went to Rajasthan, and then for my professional work, I used to write that. And I used to call my father almost every day. I call my mother, she is still around. Every day. So I would say, Papa, रोज तो phone पे बात होती है. He would say, no, no, I want a written letter. So I would
And they kept those letters, your parents kept those letters?
I just got them.
Yeah.
Describing when to Tajikistan, for example,
Right.
Kazakhstan, I would.
So how do you look at younger you? How do you see the younger Dr. Sanjeev Kumar and now Dr. Sanjeev Kumar? What's the difference?
Well, one is curiosity, which I am happy is still continuing, but not at that pace. So even in medical studies, I would read even the footnotes. And in one or two classes, when teacher asked, nobody was able to answer, including my seniors and whatnot. I would tell them, for example, after you have partial gastrectomy, part of the stomach is removed, the remaining stomach is more likely to have cancer. So when I said this to my teacher, he asked me, where did you read it? I said, sir, वो footnote में लिखा हुआ है लावेंगे
Footnote पे पढ़ता नहीं.
वो कोई पढ़ता नहीं. So very, very curious, dig deep into whatever is my area of interest. अभी तो lot of things are available on internet.
So अभी किस चीज के लिए curious है?
I want to go back into depth of our ancient literature.
Okay.
There's a lot of wisdom. For example, we define health. Everybody knows health is a state of physical, mental, social well-being, not merely absence of this. I don't agree.
Correct.
Health is not a state. It keeps changing by the hour. In the morning, something, afternoon, something, not. Physical, mental, social. When you go to a doctor, he does only physical examination and says you are fit. Little bit we understand about mental. Social terms समझते नहीं. Nobody knows. But when you go into ancient Indian literature, there are two Ved mantras.
Okay.
One is from Yajurved. Om Tachakshur Devahitam Purasta Chukra Mucharata Prashrema Sharda Shatam. God, you have created sun, you have created universe. And then it says, I keep seeing the sun for 100 years. I keep hearing for 100 years.
Okay.
And I keep contributing to the society for 100 years. And I should not become dependent on others for 100 years.
Okay.
That is the definition of health, longevity, throughout your 100 years of life. And then it says, even beyond 100 years, you are on top of all your body function. That is health.
Okay.
वो WHO ने define कर दिया, उनको भी नहीं पता. Mental social तो
So
उनको पता ही नहीं.
Indian scriptures के ऊपर आप पढ़ाई करते
So दो वेद मंत्र हैं हेल्थ के बारे में. दूसरा वाला तो और भी लंबा है, अथर्ववेद में, and it goes into 8 aspects of human life.
Okay.
And again, focus is on 100. So it is on longevity when you look at it. And I told you Vasudhaiva Kutumbakam, connecting with people. And many of these things in ancient scripture going to
Actually they indicate the high level of intellectual capital of those people, right? I think even today they are making so much sense. So the intellectual capital, intellectual level would be very, very high. And it's really nice that many of us are now getting attached to, getting time to study these scriptures, time to rather savor them, totally, like soak into them and then, and maybe spread the message also.
So another aspect is spiritual health, which has not come into WHO definition. I was in Geneva. So they used to have on how spiritual health can be included.
Okay.
But most of the people confuse spirituality with religion.
Religion, yes.
Spirituality is about you, about everyone around you. We are all children of one father or one God, whatever you call it.
Yes.
Then nature.
Yes.
All animals around you are part of spirituality. So you don't do to animals what you don't want to be done to you. Then nature.
Yes.
Plants, trees, and we have, even today we have societies in India. They don't let you cut the trees.
Yes.
If you're camping वाला ना पेड़ को cut के लोग don't let the
Chipko movement. By Dr.
That's the spirituality.
Yeah.
not just about me, about the whole universe.
Anything else, which is not related to medical field, not related to management, which fascinates you? Scriptures you said, but on the side of hobbies or some passion that you have. Some people like to drive, some people like to cook. What's that side of Dr. Sanjeev?
I'm very fond of reading. In fact, I buy more books than I read. There's always a pile of books which I have yet to read or have not completed reading. So one is that aspect. But most of these books are related to our own developments, how we look at things related to leadership and human behavior. The book which has influenced me most is emotional competence, emotional intelligence. Which changed my dealing with my daughter. Daniel Goleman is available.
Emotional intelligence.
There's one book he wrote on emotional intelligence, so where to understand what is emotional intelligence. Then the second book he wrote, written many books, is working on emotional intelligence.
Oh, okay.
So if you want to read one book, I will suggest start with working on emotional intelligence. But that's how you have to do it.
Yes. So, working in different areas now, from leadership to now scriptures to and emotional intelligence being the base for all that you've done. What you would like your legacy to be in? What it is that you would like? That's the best work of Dr. Sanjeev Kumar, which people will, emulate, will read, follow. What would be?
Now my main effort, including advocacy articles and deliver talks in medical colleges, is that this leadership skill, I don't call it leadership, I call it skill, it's a set of skills,
Yes.
needs to be imparted to medical students and hopefully to children in the school.
Start young.
They start young. Emotional is part of life, everyday life. And we behave at times in a wrong way because we don't have control over our behavior.
Somewhat our education system is little still skewed towards academic excellence compared to, the knowledge of life skills or emotional resilience, for example.
Yeah.
Emotional intelligence will automatically bring resilience. And today's youth, today's children are suffering from stress so much, because of the social media and the pressures of today's life. So they would definitely, it will do well to start young, as you're saying.
Then in the West, some years, for example, in US, they have started teaching children in preschool. Children even say, I'm getting angry. I'm getting anxious. That's where it should start.
Yeah.
It should continue throughout your education life.
Yes.
Not just medical students.
Yeah.
It should get into.
The realization that such a small child is able to say that I'm getting angry. So I need to do something about it, right?
Yeah.
Basically, the realization for a small child to know that I'm getting angry and I need to handle it,
Yeah.
manage it well. How do I handle it? Yes, excellent. I was also curious to know that you recently joined Rotary Club, right? What was the, kind of feeling, or what is the reason that you thought that you should join Rotary Club?
I have been closely watching Rotary from 1989.
Okay.
And that's when I went to Rotary Club in Kota to deliver a talk. And I was impressed with the way they have mobilized every institution across the world for polio eradication.
Okay.
When they started talking about it, if I remember correctly, in 1988, nobody agreed. Even WHO was reluctant to talk about it. But they continued to put pressure, and today, in India, it's been we are into 13th year that we saw the last case of TB.
Yes.
So that mobilization at the local club level and also at global level. There are many other areas. Some of the clubs are working on cancer prevention, HPV, carcinoma, vaccine, which we call HPV vaccine. So there are many areas, school education programs, scholarship to children, blood banks. I think the commonest blood bank you will find across
Organized by Rotary. Yes.
Providing devices and appliances to the disabled people. So they're doing a good work. Somehow we didn't have time and we couldn't think of joining because it does take your time. So now both of us have that. Now we have related.
So what programs you attend or what programs you contribute?
They have two aspects. One is camaraderie. They meet once a month. I mean, across people, well-established business leaders, professionals. They all come, and it's uh, very satisfying to talk to them. Look at how they contributed to the society, their professional growth. And then second is they look at the project. Mostly I can feel, I can giving the cataract surgery to the people who
Cannot.
that is the reason we thought we can now join Rotary and contribute and social life. At your age, you want to spend more time outside people.
Yes.
It's also related to taking care of your age-related issues.
Many of the things that you have said, resonate very well with us at Inspiring Seniors Foundation. We have been, our whole core idea is that how do we have healthy aging, longevity healthy and longevity which is purposeful, which is relevant. You stay relevant, you stay meaningful, you have a meaningful life, and you have a holistic full life. It should be full of fun, it should be full of purpose, it should be full of health, mental, physical, emotional, cognitive health altogether. So we try that through our programs, we make people aware, make people aware of the opportunities to, engage in those things, which, could be giving you mental satisfaction, could be giving you, social connection, making friends, or, learning new things. These are some of the things so you have resonated very well with, our programs, what we are trying to do. I think we are about to, kind of come to the end of the program. So some of the questions that that what we call is a rapid fire round. Okay. So rapid fire round means that very short answers, very quick answers.
We see it in media often.
Yes. It's one way to make it interesting. So what do you do when you wake up first thing in the morning?
The first thing which I do in the morning and the last few years, or not doing it earlier, I think I'm Almighty God or for giving me. I woke up, wake, healthy, and then pray that whatever I do in the day to day, I should not hurt anyone. If I can, take a breath from my everything, I should be away and get some satisfaction out of it.
Wonderful. I think this is a wonderful way of starting your day. And it kind of starts the day at a better note, like in a music, like in a better note. What do you like to your coffee? And how many cups in a day?
When we got married, I used to take about 15 cups of tea and 5 cups of coffee. And
20 put together.
Yeah. And she was not even taking 1 cup of tea and coffee. So then my tea and coffee came down to about 4 or 5 a day. Maybe 1 or 2 cups of coffee, and she started taking tea once in a while. So now it's I think about 2 or 3 cups of tea, but I don't feel addictive. I don't take tea the whole day.
Okay.
I'm okay. Coffee once in a few days. I put coffee powder in my white coffee.
Okay. So it's not an addiction anymore.
No,
It was an addiction younger days.
it was. I used to get headache and would get restless.
Because of the addiction or not taking it?
No, because of not taking it.
Okay.
And whenever posted in primary health center, we used to have cook.
Yeah.
So whenever he will make tea, he will always make it for me. And my intern and resident will ask, आपसे तो पूछता ही नहीं. उनको बताया कि जब भी बनेगी चाय तो पीऊंगा. That kind of reputation I had.
Anytime. Any film that you're very fond of, Hindi films? Any films that Sholay?
I can watch it. I don't know, may I watch it at least 10 times. I can watch it again today.
Okay. What about Sholay impressive?
The connectedness of the common character
Okay.
in a village life, and then antisocial elements, how they influence and how the common villagers come together to take a stand against them, and the life of common.
And Jay and Biru.
Yeah, Basanti.
And Basanti, yes.
No, I would say it's a hardcore common man life they have depicted, and how they stand up and face, that gentleman who will be the child, and how the village comes. comes together with concern.
Yeah, the Sholay is a landmark movie in the Indian film industry, I think. So, is there any song which kind of lifts your mood if you're in a bad mood? What do you do to lift your bad mood?
I won't say any song, पर हाँ शादी से पहले मैं एक गाना गाया करता था।
गाते थे तो सुनाइए।
नहीं
फिर
बस
सुनाइए।
नहीं तो गड़बड़ हो जाएगी। बांसुरी बजाता था मैं अभी एक गाना गाया तो मेरे सपनों की रानी कब आएगी।
Oh wow,
तो जब शादी हो गई तो बंद हो गया।
रानी आ गई।
And she is now coaxing me कि नहीं you go back to
Yes,
playing flute.
yes.
She's been looking for
Next time we meet with you and chat with you, I think हम एक performance जरूर चाहेंगे. Flute की भी और music.
नहीं अभी हमने modifying our home theater to put in karaoke.
Okay,
I can learn singing
very
and
nice.
can sing songs to my granddaughter. Tell them stories. She collected some books today from our stock of books which we have not seen for years. So, and she gave it to me. बच्चों को कहानी का book is something.
Oh wow, very nice, very nice. And you have your children who are staying abroad, outside India. How do you find retired, life or the life of senior citizens here in India to be better, or do you find the facilities there to be better?
Yeah. No, we have also lived abroad for 12 years. So there are certain things which are good in India, and there are certain things which are good outside. In India, we can walk into आपको फोन करके बोल सकते हैं कि मैं आ रहा हूँ अभी आप अगर घर में तो in the West that the social cohesion is not as strong.
Yes.
पड़ोसी के घर में you just knock and enter your neighbor. No, you can't do in the West. Yeah, I remember when my younger daughter came when we visited Jaipur, she called a school teacher. मैं आपको मिलने आ जाऊँ कितने बजे आऊँ उसने डांटा उसको ऐसे क्यों पूछ रही you get used to that way of asking for time and then you don't go and meet anybody and you can meet a person on the street and
Yeah.
in the West if something happens on it's changing in India as well. You will not touch that person. You will call the police or
Yeah.
to take care of
Sure.
that person. So that social relationship.
Social warmth is not there.
You use the right word. Social warmth is not there. Things are very systematic
Yes, system works.
in foreign countries. You day-to-day activities अभी तो दिल्ली में भी स्थिति सुधर गई है बिजली नहीं जाती पानी नहीं जाता नहीं तो वो भी एक इशू रहता था शाम को 1 घंटे आएगी तो आप अपने सारे सोशल कमिटमेंट छोड़ के 1 घंटे घर में ताकि घर में आप टैंक में वाटर टैंक लगाएंगे पानी में so basic necessities जो है and with I think technology things are getting easier in India but pollution is the main
Yes.
so bad and it is getting back to work and no action is being taken.
Yes. No visible action as of
Yeah.
now, and we hope that it is attended to sooner,
Yeah.
and at least the next generations should see better air. They should live in better air.
वहां जाते हैं वॉक के लिए एक यूआई देखने की आदत पड़ी है 15 होता है 20 होता है and when we breathe it feels so fresh.
Yes, it feels very different. It feels very different. Yeah. Well, thank you very much. I think it has been a very interesting, insights about your personal life, personal journey, and some of the things that have influenced you has been very enriching to, have this conversation. Thank you for spending time. And I hope our viewers would also like, all the messages, all the, funny and knowledgeable anecdotes that he has shared. If you have liked it, thank you for watching.